Don't drink alcohol when pregnant, not even one sip. No amount or type of alcohol is safe during pregnancy. That is the message from the Western Cape Health Department on Fetal Alcohol Spectrum Disorders Day. Now, this day is marked annually on the 9th of September today, symbolizing the 9 months of pregnancy. According to the SA Medical Journal, South Africa has the highest prevalence of fetal alcohol disorder in the world, a major public health concern. For more on the story now, we're joined by MEC for Health in the Western Cape. That's Dr. Nomafrench Mbombo. MEC, thanks so much for your time on the AM report. I mean, what a worrying statistic. South Africa ranking the highest in the world for this disorder. How does your province contribute to that statistic?
Thank you very much. It has always been the case when it comes to alcohol in South Africa. But you'll find that we mostly focus on the interpersonal injuries through accidents and all others, and lesser on fetal alcohol spectrum disorders, with also other related illnesses as a result of drinking during pregnancy. And it's not only about, there was a while in Western Cape will be a major contributor because of the history of the DOP system that was stopped long ago. But you find that you have got pockets of the other areas where actually it's not a wine area, and also outside Western Cape, for example, in the Northern Cape and some parts of Soweto. But what is said about it is that we don't realize the long-time effect of this on the child, because we are obsessed only on the visible features, physical features. Yet the impact on the brain and the delays in the neurological development of a child, that impacts on the schooling, that also impacts on how the child can process information where might not be able to determine what is wrong or right. Because we don't understand sometimes that some of the mental health and also of the behavioral problems that we see in children, it could have been through the fetal alcohol syndrome. So that's why on the 9th of September, 9 minutes past 9 seconds, we're joining the whole world where we say no amount of alcohol is safer during pregnancy. Further, we are even urging the families, the spouses, whoever is surrounding the pregnant woman, they shouldn't drink either, because you don't want a situation where now the woman might also want to join the crowd, if they used to all drink together.
Yeah. I mean, MEC, you talk about the long-term effects of fetal alcohol disorder on the child, but the effects also extend to that community.
No, of course, exactly, because I'm making an example that sometimes when these children, they don't want to listen, and then you probably, as a parent, you blame yourself, and then you think that you have set up a foundation, and then you find that the child still misbehaves. We don't think in terms of that what will have actually the contribution of the alcohol in that case. As I indicated earlier, that there is no amount of alcohol, even a spoon, or especially in the first 3 months of life, because that's when even their whole brain, actually the first 1,000 days of a child's life, first 2 years, that's when the brain develops. In the 9 months, that's why we are focusing on the 9 months, and the 9th month in terms of creating awareness that in the 9 months that you are pregnant, no alcohol should be able to pass through your mouth in order to avoid what we are talking about. Yeah. Without even going to the other defects, where we as health have to absorb when these children end up having birth defects from the heart and all of those. But the unseen one is the one that impacts on the central nervous system, on the brain, without even the child has got those physical features.
So, MEC, when you are in communities and you speak to your teams about, efforts to educate people about the dangers of drinking during a pregnancy, what are some of the stumbling blocks that you come across? Why are people perhaps reluctant? Why are they maybe not getting the message?
The issue of the behavioral change around the at-risk it's not only related to the issue in terms of the alcohol intake. Remember, the abuse of drugs, the use of unhealthy food, and all of those. These are all of the packages where we find that even for a person who might have more knowledge, it's difficult to change behavior. It could be because of the barriers or because of person not seeing that might have been at risk or might be able to get away with it. However, unfortunately, in the context of the fetal alcohol syndrome, majority of South African women, especially in the poorest communities, they might not necessarily know that they are pregnant because of the high level of the unplanned pregnancies. And therefore, knowing that there is a high level of the binging in South Africa, especially among women, and then they ended up drinking. So that's why I was saying that we keep on focusing only on the interpersonal violence or on the other effects of alcohol, especially to the adult, like the violence and all of those, but forgetting that we have got this silent impact of alcohol on children and also on the future leaders, because these are children who will end up being future leaders. And then we don't know why some people behave as such, even in the adults, when they are adults. Yet you find that there's been some of these exposures to alcohol in the first 3 months of life at the time that their mothers were pregnant.
I mean, MEC, we talk about the devastating effects of fetal alcohol syndrome on the life of the baby, the long-term effects. If we expand the effects from the community to also the pressure perhaps that is extended to our healthcare services, what does that picture look like?
In the healthcare space, fortunately, in most majority of South African women, they do attend antenatal care services where they could be able to get this kind of information. But however, when we go to the communities, like later today, this morning, out in Gugulet, where I'll be ringing the bells, joining the whole world about the creating awareness. But the issue is about when the community still drinks, at the time that they've got these women who are pregnant surrounding them. Because if, for example, over the weekend, all of us in the same house or with my partner, we used to drink, then I get pregnant. And then if he continues drinking, it means that I'll also be tempted to drink. So that's why we want to create awareness, even among the communities. As I indicated earlier, the neurological development delays, the birth defects, where some children ended up being premature babies, the cost that we have to absorb on unnecessary prematurity and also unnecessary some of these disorders that we have to absorb, not only from the child when he's born younger, but even at the education level, because those children, they ended up having all of these challenges when they are going to the school. And then you ask yourself why the child is repeating the grades or is not listening. And then you ended up as in education, you have the remedial or psychological support for those children. Yet this could have been prevented earlier during the pregnancy.
Yes, far-reaching effects of this fetal alcohol syndrome. Nomafrench Mbombo, thanks very much for your time there, the Western Cape Health MEC, in conversation with us.